Hello, my name is Dr. Diwan S. Raja. Today I will discuss a few multiple choice questions in head and neck from Norma Basalis of the skull. Let's start. Number 1. Which of the following foramen transmits the terminal part of the greater palatine artery from the palate to the nose and the terminal part of the nasopalatine nerve from the nose to the palate? Choice A. Incisive foramen. B. Greater palatine foramen. C. Lesser palatine foramen. D. Foramen ovale. E. Foramen spinosum. So what is the answer? Answer should be A. Incisive foramen. Okay, let's go to the second question. The cruciform suture of the hard palate is formed by all of the following sutures, except one. The exception is what? Choices: A. Intermaxillary suture, interpalatine suture, palatomaxillary suture, nasomaxillary suture. So, which of these sutures does not take part in the formation of cruciform suture of the hard palate? Answer should be nasomaxillary suture. It does not take part in the formation of the cruciform suture of the hard palate. So this is the answer. This is the exception and this is the answer. Question number 3. A 24-year-old woman has developed an ipsilateral loss of motor function on the whole, that is the entire side of her face, and difficulty chewing. Her lacrimation and taste sensations are intact. The attending physician suspects a lesion at or around the stylomastoid foramen. Which of the following cranial nerve is involved in this scenario? A. Facial nerve. B. Glossopharyngeal nerve. C. Vagus nerve. D. Mandibular nerve. This person has ipsilateral loss of motor function of the whole side of the face. So all the muscles, the facial expression on one side is paralyzed. She has difficulty in chewing. Okay. And her lacrimation taste sensations are intact. So what is the nerve? Nerve is the facial nerve that comes out through the stylomastoid foramen. Okay, we got the answer. Facial nerve. Number 3. We got number 3. Let's go number 4. Which of the following muscles takes its origin from the posterior nasal spine of the hard palate and inserts into the connective tissue of the uvula? A. Tensor palatini. B. Levator palatini. C. Palatopharyngeus. D. Palatoglossus. E. Musculus uvulae. So, from the posterior nasal spine of the hard palate to the connective tissue of the uvula, our answer should be what? Musculus uvulae. Okay. Now, question number 5. Which of the following muscle is innervated by the mandibular nerve? There is V3, the third branch of the trigeminal nerve, via the branch to the medial pterygoid muscle. Okay. Levator palatini, tensor palatini, palatopharyngeus, palatoglossus, musculus uvulae. So, which of the following muscle is getting innervation from the mandibular nerve? Answer should be tensor veli palatini. This is the answer. Tensor veli palatini. Number 6. Which of the following foramen is filled with cartilage with nothing passing through? But the upper part of this foramen is traversed by the internal carotid artery and greater and deep pectoral nerves en route to the pterygoid canal. So it is filled with cartilage with nothing passing through. Answer should be what? Pterygoid canal, lesser palatine foramen, foramen lacerum, carotid canal, foramen spinosum. Answer should be foramen lacerum. This is the answer. Number 7. Which of the following nerve lesion results in vasodilation, lack of secretion of lacrimal, nasal, and palatine gland, and loss of general and taste sensation of the palate? Which nerve? Medial nerve, mandibular nerve, lesser pectoral nerve, maxillary nerve, lesser palatine nerve. Answer should be A, the median nerve. It contains sympathetic, parasympathetic nerves and will get this type of features. Okay, we got that. Number 8. All of the following structures pass through the foramen magnum except one. Foramen magnum is the largest foramen at the base of the skull. So multiple structure passes through it. Let's start. What are the structure? Passes through that, and what is the exception which does not go through the foramen magnum? A. Vertebral artery. B. Anterior spinal artery. C. Posterior spinal arteries. D. Internal jugular vein. E. Roots of the accessory nerve. What is the structure that does not go through the foramen magnum? Answer should be internal jugular vein that passes through the jugular foramen from the sigmoid sinus to the internal jugular vein, and that is a structure of the jugular foramen. Okay, that is the exception here, and that is the answer. Number 9. Which of the following external foramina of the skull transmits 3 cranial nerves? 3 cranial nerves. These are the glossopharyngeal nerve, vagus nerve, and accessory nerve. So all these 3 cranial nerve passes through which foramen? A. Choices are here. A. Foramen rotundum, foramen ovale, foramen magnum, jugular foramen, stylomastoid foramen. What is the answer? Okay, foramen rotundum for the maxillary division of trigeminal nerve. Okay, foramen ovale for what? For the mandibular division of trigeminal nerve. Foramen magnum for the spinal cord, anterior spinal artery, posterior spinal arteries. Okay, and the spinal accessory nerve, and also the roots of the accessory nerve. Stylomastoid foramen for the passage of the, for what? For the passage of the facial nerve. Jugular foramen is the foramen through which all 3 cranial nerve is transmitted, the 9th nerve, 10th nerve, and 11th nerve. So answer should be the jugular nerve. Okay. D. Number 10. What is the nerve supply of the posterior belly of a muscle that takes its origin from the mastoid notch? What is that muscle? That muscle is the posterior belly of the digastric. And what is its nerve supply? Mandibular nerve, facial nerve, hypoglossal nerve, vagus nerve, spinal accessory nerve. Answer should be facial nerve for the posterior belly. Anterior belly is innervated by the mandibular nerve for the mylohyoid branch. Okay. Anterior belly of digastric. Posterior belly of digastric innervation by the facial nerve. Answer is B, the facial nerve. Okay, these are the answers, all the answers here. And that's all about the MCQs, 10 MCQs in head and neck anatomy. Norma Basalis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.